Research has shown that in the fight against depression, medication can be a powerful tool. Although effective, medication is still a complicated and controversial approach. And just like depression itself, it can carry an all too familiar stigma.
Medication in this culture is something that you take when you have a major problem, right? So if a man is not seeing depression as a real serious problem, he's probably less likely to be interested in taking medication.
Part of what makes medication as a form of treatment so complex is that one medication does not fit all, and that medication can affect people differently.
It's the usual questions from the patient. What is the best medication for the depression you know? And what it is usually, it's different for each patient.
So if you walked in my office and said, my sister was depressed and she really did well on Effexor, that would be a reasonable guess because, you know, you're biologically and genetically related to your sister. But if you walked in my office and said, no one in my family has ever been depressed, I've never been depressed, it's the first time I've ever had this happen, and you said to me, how do I pick an antidepressant then? I could literally flip a coin.
Our brains are complex and often a mystery. Medication, however, has been shown to work by affecting the chemicals in our brain.
There are highways in the brain which are connecting, and there are chemicals running on it, and there are different chemicals running. And what we need to figure out is how to modify those chemicals, because sometimes patients don't have enough of those chemicals, sometimes they have too much of those chemicals, and so different medications are working on stimulating those chemicals or slowing them down. And again, it depends on the patients how the patient, what kind of symptoms patient has, and then we are trying to tailor the therapy and tailor the medications for the symptoms the patient is showing.
In the healthy brain, each of the neurons release chemicals called neurotransmitters that communicate with adjacent cells. They function like an elaborate circuit board. In the depressed brain, it appears that some neurotransmitters, like serotonin, dopamine, and norepinephrine, stop working properly and communication breaks down. When that happens, symptoms of depression start to manifest themselves.
There's not a single neurotransmitter that's responsible for all of those symptoms, namely the fatigue and trouble concentrating and decreased memory and decreased libido and inability to experience pleasure. That's not a single neurotransmitter, but we do know that there is a relative serotonin deficiency in many patients with depression. We know that norepinephrine appears to be dysfunctional in depression, and more recently we've learned that dopamine, which is the neurotransmitter involved in the ability to experience pleasure, is also awry in depression, and other neurotransmitters as well.
Many antidepressants, like Zoloft and Prozac, work in a similar way, targeting malfunctioning neurotransmitters and restoring communication. This process can take 6 to 8 weeks.
That's Remeron. It's an atypical antidepressant. It supplements the effect of the other antidepressants. That's Zoloft. That's my primary antidepressant, an SSRI. This is Wellbutrin. Wellbutrin is also an antidepressant, but it's also somewhat stimulating, and some of the others are sedating. That's Zyprexa. It's an atypical antipsychotic, which is also useful in control of anxiety associated with depression. This is Namenda. It's actually an Alzheimer's drug, but it has some mild antidepressant effects, and it's sometimes helpful with the cognitive slowdown you can get from the Remeron and Zyprexa. That's ranitidine. It counteracts the weight gain effects associated with the Remeron and Zyprexa. That's one kind of fish oil. I take 2 kinds. That's my morning.
Medication is not without risk. A common issue with antidepressants are the potential side effects that may occur.
Depression is a very common illness in the United States. It causes a lot of problems, a lot of lost hours of work. It causes a lot of problems in relationships at home. It causes a lot of problems in relationships at work. So there is a lot of people who are using the antidepressants. Yes, there are side effects like everything else. You have to put the balance between the benefit and the bad things which are happening from the medications.
It started to feel better, and then it started to feel a little better, and it started to feel a little better than that, and it kept, until finally I felt like, once I felt up a little bit, that's when it really occurred to me that I've been operating with a low-grade depression for all of my life, because I hadn't felt like this at all.
Antidepressants, in my opinion, are studied very, very well, and we know what to expect from them. So we know that some of them can upset the stomach, some of them can make people agitated, some of them can be a problem with sleeping. And again, we learned a lot of different things, and we learned how to help it out to get those things under control. So patient has to be educated about the effects and the side effects of the medication. And when the side effects are showing off, the patient needs to contact the provider to find out the way how to eliminate them.
Sometimes I look at this whole thing full of pills and I think, over the next month, I'll eat all of those pills, and just the quantity of them completely overwhelms me. It seems like so much stuff. And I look at them when they're in my hand like that, and I think to myself, that's what stands between me and insanity. It's a very unsettling experience.
Despite the risk for potential side effects, when medication is diagnosed properly, monitored, and adjusted, it can not only be effective, but can also be safe.
For the most part, the antidepressants are very, very safe. There are certain warnings that we give people if you have certain side effects to let us know as soon as possible, but they are not dangerous medications. They're safe medications, and what we do when we prescribe them is we give people some side effects to watch for. We keep a good eye on people after we give them antidepressants. It's recommended that we see people regularly after we start them on an antidepressant to make sure that they tolerate it well. People tend to tolerate them fairly well, and they tend to get better usually within a couple of months. People are feeling quite a bit better from an antidepressant.
I am glad that I stuck with it though, because the med now, I mean, it's certainly not a miracle pill, but it does take the edge off enough so the down days aren't quite as down, and my mood doesn't fluctuate as much, and I don't feel as anxious, and it's easier to stay positive and work in therapy when just the edge is off a bit.
Some people are afraid that because they don't do as well when they go off them, or they have symptoms when they go off them quickly, that means they're addictive, but they're not. Some of them need to be tapered off slowly so they don't have symptoms of discontinuation, but there's no addictive properties of the antidepressants.
Antidepressants are not only an effective form of treatment for depression, but they can also reverse the damage done to the brain by the condition itself.
Illuminating new studies of the brain have shown that the prefrontal cortex and the hippocampus are smaller in some patients with depression. But it appears that antidepressants might actually reverse the damage.
In contrast, antidepressants increase the rate in which neurons actually are born and grow. So the idea has been suggested that depression is in part a disease where neurons in the hippocampus are degenerating, dying, or shrinking, whereas antidepressant treatment actually reverses that process.
With the proper assistance, medication can be a safe, effective, and often life-changing form of treatment for depression.
Medication have their own, as I discussed, have their own risk and benefit. So we usually have to always assess that for the patient. That's the reason we follow up with the patient regularly to assess the side effects and see if that medication matches the patient. Overall, if there's a risk of patient being unsafe and not able to function, and there's some issues about some concern about the patient's safety again, we definitely have to start the treatment, but through the follow-up, we usually minimize the side effect and start matching and combining the medication the way that it fits the patient. So it's helping 65%, and I think this is very good.
In aggregate, I think there's no question that the value of treating, the benefits of treating with medication, and particularly with medication and cognitive behavior therapy, far outweigh these small risks, and those risks can be mitigated.
Depression can take a toll on life, but with powerful tools such as medication, depression can be transformed and overcome.
And I think the most important thing is that you will recover, you will be okay. This is an incredibly treatable condition. Just whatever you do, don't give up. I love you.
These experiences of darkness make the light more beautiful. That the pain of being acutely depressed allows you to experience an unbelievable happiness in every day when you aren't depressed, and a sense of each of those days as a gift. So that's the real message of hope, is that you can get better, and when you do get better, not that you'll look back on it with great longing, but you may look back on it and think, I learned a lot by going through that, and I'm a better person because I did it.